Hello, everyone, and welcome to the webinar, The Hidden Growth Engine. We're going to give it a couple minutes, a minute or two, for some more folks to be admitted into the Zoom webinar. And thank you for being punctual and on time. And we'll just wait another minute or so. So bear with us. We'll go ahead and get started here. It's almost about to turn to 2 over the hour. Just quick little introductions. My name's Corey Smith. I'm Director of Sales for Tactical Back Office, and I'm looking at some of the names in the webinar so far, and I recognize many of those as current clients, so thank you for joining, and I see some names I don't recognize, so thank you everyone for making time out of a busy Monday, I'm sure, to join us. I also have Todd Usher. He's our founder, and this idea of Tactical Back Office was all conceptualized from his needs, and it's evolved over time, but Todd's going to share some insights and his experience using the remote staff and what it's meant to his company and our clients as well. And we're going to dive into what exactly is the hidden growth engine and how you can utilize the staff members to not necessarily just keep your business going, but grow your business and not be scared to expand or take on new business offerings or referral sources, payers, you name it. Go ahead and remain muted. At the end of the session, we'll open it up for Q&A. We can either open up folks to ask verbally or to chat and put those questions in the chat in Zoom. Feel free to ask those during the session, and we'll get through those at the end, if so you don't forget maybe what you're thinking at that time. If anyone after this meeting would like to meet with me and or Todd, feel free to reach out to us, and I'll share my contact information and some bits after the webinar. So let's go ahead and kick things off, if you don't mind. I'm going to ask our moderator assistant to move it to the next slide, if you don't mind. So again, welcome to the new growth engine. What I'd like everyone to think of during this, short session, we're not going to keep it too long. We know that everyone is busy and has probably a lot of other things to attend to after this. So what we want to hopefully accomplish here is to not think of us as your typical outsourcing partner, not to think of us as your typical staffing agency either. We believe we do things a lot different here, and there are a number of things that we'll discuss, not just with what we've seen from our clients and what our clients have told us, but also what our founder has realized from using the Tactical Back Office remote staff to not only help his company be insulated from all the pressures we get from the outside, the reimbursement cuts, the competitive bidding rounds, and durable home medical, the payers making things more difficult for us to get reimbursed on, but not just to be insulated from those, but also to be able to grow and maybe even start a new business segment. And Todd will share some of those ideas. So again, I want to emphasize that most of our clients, and we'll talk about this more down the road, consider us a partner that at the end of the day provides staff that'll be onboarded to your team, and you'll consider them like you would part of your team. And with that, we'll go ahead and move on to the next slide. And I'm going to reintroduce Todd Usher, our founder, for anyone that might have came in a bit late. And Todd's going to share a little bit about what we mean by the 3-for-1 rule. So go ahead, Todd.
Thanks, Corey. The 3-for-1 rule, what I have found out by using this system of staffing is just the cost savings is one segment of that 3-to-1 rule. If you hire local staff and add the workman's comp, insurance, the liability, the PTO, the time off, the sick, the vacation, all that good stuff, it turns out to be about 33% more than what you're paying base rate for that employee. And so using our TBO team has allowed us to enjoy a cost savings of that. For those who have been using this system and realizing that cost savings, what it's also allowed us to do, and what we found out early on, it allowed us to build in some redundancies. So where before we would have somebody go on PTO, vacation, sick, call in, leave without notice, would be scrambling to cover that position. Usually a lot of ownership has to step in on weekends to cover that. Whereas using this system allows for some redundancy and some coverage. We don't have to put in the weekends as much as we used to, or the late nights as much as we used to. We can afford to have some either redundancy or some built-in mechanisms to be in place to where we don't have to scramble if somebody calls out sick or leaves or goes on PTO. So that's helped us out quite a bit. And that was one of the first things we discovered when we started using TBO staff members, is now we have a cost structure in place to where we can build these in and not stress when somebody is out for the day. So it's allowed us a lot of where we're not focused so much on price as much as operationally, it's a smoother operation where we continually have coverage in place to take care of our clients. And from an ownership standpoint, it allows us to go out and do what we want to do. And usually that's grow our business, build out our infrastructure, make plans for the future, as opposed to worrying about the want ads and hiring and people not sticking around and all the mess that goes along with hiring and retaining people. So with that, rethinking staffing from a vendor to an embedded partner, which is what we'd like to be thought of, I'm going to let Corey talk a little bit more about that.
Yeah, thank you, Todd. So this kind of goes back to what I said initially when we kind of kicked off moving through the slides, and it's we want to emphasize that we're not just your typical outsourcing firm. There's a lot of them out there. There's a lot of companies that'll do your billing for you. There are a lot of companies that'll do handle certain components of your company's business needs. There's AI companies popping up every day now. It seems like there's a new one out there that's promising they'll do this process for you, whether it's intake or AI agents answering the phones. And there's good with those type of programs and services, but they don't do everything that businesses need, and sometimes they're real expensive. So I would like to emphasize, Todd and I would like to emphasize that you think of tactical back office as an embedded partner to your business that will constantly be able to supply you with staff. At the end of the day, whether we're using AI to be automated and more efficient as we should, we're using outsourced partners to help us scale better. At the end of the day, we still need people. Things may change, but right now, we still believe that people are needed. These people that we prepare and train and assign to you as a client that you've interviewed, if you wish to interview them, integrate them to your teams. Make them feel like they're part of your team. Don't let your local team think that this is something that's competing with them. Have it all mesh and work together. As your needs evolve and change, and you need to add more people, that's why we're here. Within 2 weeks, we can get you someone that has already been vetted and trained by us, which I'll talk about here over the next slide once we move forward. But know that there's always a project to be done, or we are told there's always a little project to be done. Maybe you're switching from one CRM to a new CRM. Maybe you're switching from one EMR to another EMR. Perhaps you're taking on a new vendor partner. Perhaps you are starting to partner with a new insurance company, and you're going to get an influx of new verifications you need to do. You know, the list goes on. There's always a need, whether it's short-term or long-term. These staff members of ours, most of them are full-time and stay long-term with our clients. In fact, we have a less than 1% staff turnover rate with our clients. That's a number that I kind of had to scratch my head at when I first heard it from Todd. Overall, that's an overall number. Overall, our entire staff that have been assigned to clients have a less than 1% staff turnover rate since 2019. It's tremendous. And there's a lot of reasons for that, which we could discuss down the road if you wanted to have a further meeting down the road or ask it during the Q&A session. But these people don't have to be long-term. They can be part-time. They can be assigned to you for a temporary project. In December and January, late part of the year, early part of next year, there's sometimes a lot of catch up to do with the busy deductible season and things like that. So consider TBO for needs like that, or just for your general business need if you are growing or if you're having a hard time finding people locally. The roles that
And we
we're
just had a
filling.
client, I'm sorry, Corey, I'm going to interject. We just had a client out west that lost a contract and they had to return some folks. And it was painless because they don't have to go through the process of laying people off. And they simply return them to TBO when we get them reassigned to another client. So the TBO team member is continually employed. If we need to do a little retraining, we'll do that. But then within a week or two, they're onboarded with another client elsewhere. Just makes that whole process, and the same in reverse. If you get a new contract, you need 15 people to service that contract, then order it from TBO and we can get those people to you within a couple weeks. So it just makes the whole onboarding, offboarding process easy and painless, and you don't have to stress about hiring, interviewing, being ghosted, all the good things that go with hiring and employment right now. Thank you, Corey.
No, thank you, Taz. Good point. And we are often asked, well, what can these people do for us? You know, what sort of roles or tasks can we have them do? Oftentimes, even if a client has used either virtual or remote staff before, sometimes the most critical need they have is perhaps all they think about, and that couldn't be potentially further from the truth. And Todd will talk about this more when he shares some insights about how he's built his business up and grown his business and even started 2 new businesses using these people. And they can do 80% or more of your organization, potentially maybe even 90% could be done remotely. The only thing that we haven't been able to fill are roles that require touching, a driver for durable medical, a nurse that needs to physically do something with the patient. But if anything can be done remotely, challenge us. If we haven't done it before, oftentimes it was brought to us by an idea from one of our clients, and you know, we can do that. And we'll talk a little bit more about that down the road. But a good example that Todd will use is bookkeeping, and I won't steal his thunder. I'll let him kind of explain some of that when Todd shares. Let's go ahead and move to the next slide. So what is the invisible advantage and what is Tactical University? We've recently rebranded the name of our training program to Tactical University. It is led by May Padoan, who has been with Todd for years and is a DME expert. And she's also worked in other healthcare verticals as well. She has a team under her that gives all of our staff up to 16 weeks of training and vetting before they virtually set foot in your door. Nobody else is doing this that has a similar business model to what we do. Let me say that again. There is no other company that is pre-vetting and training the staff like we are for up to 16 weeks. Oftentimes, a client will tell us they had a wonderful person assigned to them, but they had no idea what HIPAA was. They didn't understand HIPAA. They didn't know how to read an LCD. They didn't know how to handle information securely. They didn't know how the insurances work. They didn't know what the differences might be between private insurance, Medicare, and how the states' Medicaids are different. All of these people that we bring up and vet, they're assessed for their communication skills. How well do they speak? How well do they retain new information? How much can they potentially accomplish once they are assigned to a client? And then you as a client would come to us and say, hey, I need 1, 2, 3 or more people to do these tasks, and know that they have already had exposure to EMR applications such as Brightree, such as Nico Health, Simple Practice, Epic, and the list goes on. Oftentimes, they will have exposure to not just classroom training with these items, but they will have firsthand experience doing the work that they will ultimately be doing for you. And as an example that I'll give you, insurance verification. They would have already called insurance companies to obtain authorization and verification needs for whatever product category that they're needing to get that for. And what we have found is that gets them, our training program gets them up to 80% trained. So then when they come and on board with you, you're only spending about 20%, sometimes less of that time that you would normally spend with someone that you hire locally. Nothing will replace the fact that they still need to be acquainted with your local procedures, processes, your way you do business, what insurance did you take, which ones you don't, the payers you work with, the payers you don't, those just, nuances that any business has, but they come in ready to go, ready to contribute just as fast, if not faster than any local hire based on the feedback we receive. If you have any concerns about the person or the people that you interview or that you're assigned, just let me or my team know, and we can, or the operations team know, and we would always be able to get you more candidates. We always have a steady influx of people that are ready to be interviewed and onboarded in as little as 2 weeks, sometimes less. I say that because I don't want you to think that you're waiting anywhere near 16 weeks for a person. We always have people that are ready to onboard in 2 weeks or less. With that, I'm gonna.
And if there's somebody, I'm sorry, Corey, if there's
That's
somebody
okay.
that you don't like, that you did on board and 2 weeks later they're not fitting, return them. They may fit somewhere else. They may have slipped through the process. I mean, we're dealing with human beings, so not everybody's going to fit the model, but we certainly want you to be happy. So please return them, and it doesn't mean we're going to cut them loose. It's just we're going to reevaluate them, see if we properly placed them, possibly put them with another client. But we want to make sure you, the client, are happy with the people that we're giving you. And that can be, from the first person you hire to the 10th or 12th person you hire. You want to be happy with those folks. And if somebody's just not cutting it, please let us know so we can work with you to get a replacement and get some retraining for that other person. Thank you, Corey.
Yep. Nope. Thank you, Todd. And I mean, that's a good segue because the next section, if you don't mind moving to the next slide, is we find that oftentimes clients aren't using the TBO to the full potential that they could. Not everyone goes into this maybe with the same mindset that Todd did years ago for his businesses. But there is a lot of other things potentially you could have them do for you, or you could bring on more people to help. So go ahead, Todd, and share a little bit more about, what maybe people could use the staff to do more of.
Well, when we first started this about 10 years ago, we started with somebody who was processing CMNs, and we needed a proof of concept that this was even going to work. So about a month later, our prior authorization person quit, and we decided, well, it's working so far. Let's try another person on PARS. So that's what we did. About a month after that, month and a half after that, we had horrible turnover. The patient collections person left, and we replaced them with a TBO team member. And then our first intake role came up about 6 months into it as for power mobility. And we started that power mobility, and it was, you have to go through the prior auth on that. There was a few things they had to learn, and it worked out. So we just started with that one person and then built it out from there. And really, it was through attrition that we built out our company with the TBO team members. We didn't really have to go out and get rid of anybody. When they left, we backfilled it with a TBO. And about 18 months after that, most of our call center was gone. And today, we have 6 original team members from a 40-person team 10 years ago that are still with us to one degree or another, supervisors, whatnot. And it's worked out wonderfully. So I feel that for us, our experience has been start off with that 1 or 2 people. And if you're unsure, of course, you can always go back and locally hire, but we've been able to fill all roles that we've set out to do, from billing to bookkeeping, QA, posting, every position you could think of in a healthcare, home care environment, we've been able to show that we can not only do ourselves, but do elsewhere as well. So I would encourage you, if you haven't tried TBO, to start off with that one position and see if it's going to work, because that's what we needed to do to make sure this proof of concept, what we were thinking, is actually going to fit into our business model. So we have a real world application of not only what we have, but our ability to completely transform our company into something that 95% of our operations are ran by our TBO team. And it has allowed us to not only expand our different businesses into different geographies, but also open up new businesses as well. And I think that has been crucial in our success, Because if I go by the gas station, I don't know from one day to the next what I'm going to pay for gas. And it seems like the same way with human resources or personnel or staffing. I don't know from one day to the next who's going to have that expectation. When I hire somebody, are they going to show up? When I give them a job offer, are they going to stay past the first couple of days of the first week? Not everybody's like that. We all have our core people. That's understandable. I'm talking about when we're growing and hiring. It's a challenge. It's stressful. It's a lot of it's disrespectful, to be honest with you. So it's allowed us a surefire way, confidently, to go out there and grow our footprint, grow our different businesses that we're opening, knowing that we have a pipeline of staffing that are going to be trained and staff and can staff our business so we can run it. I don't have to work. We've been full staff for the better part of 8 years. We haven't had too many vacancies, and those vacancies have been filled by TBO, most of them. Of course, there's exceptions to the rule, like drivers and whatnot, but it's wonderful. I'll be honest with you, it's the way it should be. It's the way it should be. When we're running a company, we should be able to rely on smart individuals to come in, do the job, start working when they're supposed to start working, and achieve their KPIs. And that's a wonderful feeling from an owner's perspective, that we can go out there confidently and say, okay, let's do these other things, knowing I'm going to have the staffing to do it. So let's do the next slide. So real world application, as I just kind of talked on, we opened up a sleep diagnostic center about 6 years ago. We opened it up with the mind of what I just talked about. We're going to staff it completely with TBO. So billing, scheduling, intake, follow-up, grabbing that paperwork from the doctor's office, all those things. The only local personnel we have are the sleep techs or the RTs. And then we even have some backup in the Philippines that will assist with that. We've been able to recruit some RPSGTs that are internationally certified and can work in the United States. And we've been able to use those as well. On our other businesses, we've been able to expand and only expand the logistics part of it. But intake and dispatch and, of course, bookkeeping and everything else, they're all centralized with TBO. We don't have to expand on that. All we physically need to expand on is logistics and a building and trucks and that type of thing. So that's been wonderful to do because it makes it a lot easier. There's not a lot of the headache that goes along with hiring to expand on those branches. And we've experienced that. I think something that Corey mentioned about Tactical U earlier is not only are we giving people up to 16 weeks, but they're training in a real live environment as well. So they're not going to just train in a classroom. They're going to go work for one of our companies for about a week and get some real world experience of what it's like to talk to a medical assistant, what it's like to talk to a patient, what it's like to take a complaint. How about following our accreditation and having those complaint logs kept up and followed up with? They can do all of that. It really helps to allow us to be compliant with our accreditation. All those little busy work administrative duties that we have to do, we hire our TBO folks to handle that for us, so we don't have to spend local talent on to doing that. So allowing our company to grow, allowing new businesses to develop, and not having to worry about staffing, real world, I can tell you, it's helped tremendously. And we don't put in as many weekends as we used to, and not as many late nights either, because now we have the staffing to cover it, and it's not falling on us as owners or managers or executives to have to scramble to get that work done. So I've enjoyed that. So I think that brings us to our live Q&A session. I hope this gave you kind of an overview, not only for our existing clients to kind of see where we've done things, but of course, new potential clients that are interested, that this was something that we never thought we would see happening, but with compressed reimbursement and with the environment of expectation with local staffing, it makes it hard. Banging my head on a brick wall doesn't do it justice, what we've had to go through as owners out there. So this is a real world solution. And the wonderful thing is the ROI is next month. Not next year, not in 13 months, 18 months, or 24 months. Next month, I start saving and seeing the benefits of that as soon as you start hiring folks. And I hope the folks that are on the call that are existing clients have seen that as well, because that's what we've seen, and we've appreciated that the ROI is instant almost, and we get to enjoy that. So I'll open it up to any live Q&A questions through chat or however else we're set up, and I'll shut up and listen.
Looks like we have two questions that have been sent through chat. They're both anonymous, which is fine. The first question is, what is the normal onboarding time that I need to put aside when hiring a TBO member? Do you want to answer that, Todd?
We've been told by our clients. No, I can. We've been told by our clients 2 to 3 days. That's what they're telling us. That's kind of what we experienced. We've just put them through up to 16 weeks of training. I say up to 16 weeks. Some people only take 8 weeks. But we kind of know what you're going to be looking for after we've vetted you and your request. So we've been told 2 to 3 days, and that's been our experience with our other businesses as well. And then it's just inculcating your culture into them after that. But just the initial onboarding should only take 2 to 3 days. I think that's at the far end. Some of them, they can start hitting the ground running the first day, but that's up to you.
And I'll piggyback just a little bit to that. It also obviously depends on the role with regard to kind of what you would want to plan for or be prepared for. But know that that work that we're doing up front with that up to 16 weeks of training, there's some things that we'll offer if you aren't an existing client and haven't done this before, and even if you are an existing client, if you have any training materials or guides or documents or job aids that you'd like to share with the training team and the operations team, we can do some pre-work to get them reviewing that to help make that onboarding process a little bit better. The second question I have here, Todd, is beyond the cost savings, what are the other benefits that I will see from TBO?
So the other benefits we've been told about by our clients, I won't use my own personal experience because I mirror what they're saying, but our clients have told us is, generally speaking, an overall work ethic that is lacking from local talent. When it's 8 o'clock, they'll start working, not at the coffee pot or the water cooler or at their friend's cubicle or going outside for a smoke or whatever the case may be. They're actually working. Second one, I heard from a manufacturer partner of ours down in LA. He said, you know what I like about your people? They show up, and that was great. That was a heck of a compliment. And I knew what he meant by that. They show up on time and they're working, whether that's 8:01 a.m. or whatever the time their start time is, they're working. And that was a second compliment from that. To go along, it's not all rainbows and unicorns. There are some things that go on out there. So I'll throw that out there as, some issues may be, once we're dealing with human beings, sometimes we'll get a sour grape and we'll deal with that. You return them to us, we'll deal with it. It's painless to you, and we'll get you a replacement within a few days. That's what we want to be. That's what it is to be an embedded partner. You don't have to worry about staffing. We'll take care of the dirty stuff and get you squared away. Because that's what I wanted for our own business. I didn't want to deal with it. Another one is, for those of you shaking your head, which there was probably 1 or 2 of you about the 1% turnover rate, please put yourself in their shoes. When they're working for TBO, they work in an environment that is close to home or at home, and they're not commuting 2 or 3 hours each way to a skyscraper in downtown Manila and then 2 or 3 hours back. And that's a real environment for them. So we like to take care of our folks to the best of our ability. We've set up our infrastructure and IT and security to be in this place right now. Our competitors that do use buildings, that's a fact of life, and it's miserable, and they're in tight cubicles and recirculated air and artificial lighting. And if they have a baby that's sick or a husband that's sick, or they're not feeling good, or they have a cough, they don't want to go into work, they'll call in sick. We've heard this firsthand from our recruiting team. And that's why we are an attraction to folks out there, because we're trying to give them a different environment that's not standard out there. So that's some of the not so great things that have happened out there. And turnover, you'll see turnover with our competitors. much worse than what you see with us. But we're not a service either. You know, we are a staffing agency. So if you want to hire a service to handle your billing and farm that out, that's great. Then that some people don't want to deal with it. And I get that. I completely get that. But if you want to handle it in-house, you will realize the cost savings because the service is going to take a percentage of your revenue or a higher rate than what we're going to charge you.
Yep. Thank you, Todd. And I'd like to also add to what you just shared about our turnover rate being 1%. Another thing that we've done recently, actually not too recently, because we did this close to 2 years ago internally, is we offer health insurance to the staff members. It's uncommon. It's very uncommon for a company like us overseas to offer health insurance, an HMO, and dental to staff members on top of also PTO, and that helps them feel appreciated, helps improve their quality of life, and it's a great thing to offer. So that's also kind of help contribute to the high retention rate and the extremely low turnover rate, because this is a very good situation for the people, and this is their career. This is their career, and they're going to be very grateful to be assigned to you as a client. I don't see any other questions that have come in. There are one or two others that quick ones that I do want to ask that we had before sent to us before the webinar started. And the first one is, what strategies do you recommend for small to mid-sized staffing firms or businesses to scale efficiently while balancing cost savings and employee retention?
I would just strategy that we've deployed was start with one and get used to it. Get your local people used to it. Include them on your meetings. Use video conferencing so you get to know them and their facial expressions and if they want to participate or they're quiet. And then start with two, same thing, video conferencing. We don't do too much video conferencing anymore because we know everybody. But I think to get acquainted with your folks, they want to see you, you want to see them. You want to make sure they understand the instructions that you're giving them. I would start off with that one or two, and we became true believers pretty quickly that they were competent, quality people that we were getting, unlike some of the people that they were turning over with. You're on mute, Corey.
Thank you. Thank you, Todd. There were a couple of the same question, and I'll just address it real quick because we've already kind of talked about it, but it was, how can we help your agency reduce cost? And, not to take the words out of Todd's mouth, but, when looking at business expenses in today's landscape, especially with reimbursement cuts, competitive bidding in the home care sector and the durable medical sector, payroll is a big cost. And if you can hire the same quality and ability of a person and pay what you would pay, get 3 of them for the price of one local US person, that's a good place to look. And I'll leave it at that because we'll expand on that here in a little bit. When we get toward the end of the webinar, we'll have a brief little offer for you to look at. The last question, Todd, is, how do I choose the people I get to join my team? Do you select them or do I get to interview them?
Either way you want to do it, you're the boss. So if you want to interview your folks, great. We'll set up 2-3 interviews. If you don't like those 2 or 3, we'll set up another 2 or 3. If you want to say, just send me your people and I don't have time to interview, I need to get my business up and going, then we'll send you folks. Again, you're not stuck with them. You can return them if you want, but we can do it that way. So we have about half and half that do that. Half want to interview. The other half just says, just send me people and I'll get them onboarded and get them squared away. So it's up to you. You're the boss.
Yep. And that's a good segue, that question. And the way you answered it, Todd, is some people do and some people don't want to interview them. It's completely up to you. And we will follow your lead. And we have an offer for everyone on this webinar. Please reach out to us if you'd like to move forward or even add an additional person. And the offer is, if you need 1 person, 2 people, or 3 people, we will offer you up to 3 candidates for your first full month, and you will only pay for 1 of them. And part of the reason why we're doing that is, at the end of the day, they're human beings still, and we aren't perfect. Not everything is rainbows and unicorns, like Todd said, and sometimes we maybe misplace somebody, or perhaps something comes up in that individual's personal life that kind of distracts them, or doesn't work out the way we all hoped it would. But by having three people and only paying for one to assess for 30 days, at the end of 30 days, decide if you want to keep all three, the best one, the best two, or try someone else. Let us know. And we believe that's a good offer, and that's something that we would like to extend everyone here on this webinar today. So with that being said, Todd, I think that completes our webinar. If anyone has any questions or would like to connect with our sales team, please reach out to us at sales@thetbo.com or go to our website, tacticalbackoffice.com. And there's some contact us pages on there and links to contact us. And we appreciate everyone's time. Thank you so much for making time out of your day to
Thank
spend
you very
about
much.
40 minutes with us. Thank you.
Yeah, thank you very much, everybody. Have a good day.